This is Weekend Connection on the Bible Broadcasting Network. Perhaps most, if not all of us, know of someone who has suffered a stroke. Matter of fact, we're told that 70% of adults age 55 and above have 2 or more risk factors for cardiovascular disease, but may not be aware of it. Although you lack the power to change some risk factors, there are some key heart disease prevention steps you can take. We'll discuss heart disease awareness on our program today, so let's get connected. Our guest today on BBN is Dr. Rani Whitfield, a board-certified family physician, currently in private practice in his native Baton Rouge, Louisiana. Dr. Whitfield is an impassioned advocate for increasing the awareness of health-related issues. He has represented the American Heart, American Stroke Association, and its Power to End Stroke campaign. Dr. Whitfield, thank you for joining us today during your very busy schedule today to join us for Weekend Connection.
Thank you so much, and again, it's a pleasure to be here. Got some crazy weather in my part of town, but again, good to be here.
Starting off, perhaps most, if not all of us, know of someone who has suffered a stroke. Matter of fact, we're told that 70% of adults age 55 and above have 2 or more risk factors for cardiovascular disease, but may not be aware of it. Now, some stroke factors are hereditary. What risk factors cannot be changed, Dr. Whitfield?
Yeah, that's something frequently we discuss with the patients. And we can, of course, change age as we get older. Our risk for many diseases increases, including heart disease and stroke. Family history, if you had a family member that's had a heart attack or a stroke, especially a first-degree relative like your mother, brother, sister, that increases your risk. Certain ethnic groups have a higher risk. Gender. If you've had a prior stroke, I've had a TIA in the past, or even a heart attack in the past, all those things are risk factors that we cannot change. So we have modifiable risk factors, things like smoking and weight loss, which you can do something about. But those non-modifiable risk factors, things we cannot change, include age and race and gender. So it's good to know these things, but that does not mean that a stroke or heart attack is inevitable.
No, I think many would be shocked to find out that women actually have more strokes than men each year. What are the contributing factors for this in women?
Women are more likely to suffer a stroke than be diagnosed with breast cancer. And not to downplay breast cancer at all, it's a very serious condition as well, but I want to make that point clear. More women than men die of stroke each year in the United States, and we think this mainly because women live longer than men, and stroke risk increased, as we said earlier, with age. There's also the risk factors that we have to look for in stroke, such as high blood pressure, the migraine headaches that you have, but these are migraines with aura, so something that appears before. Atrial fibrillation, a heart condition where the heart actually shakes or flutters, I'll use the word fibrillation, not flutter, because there's something called atrial flutter as well, but atrial fibrillation where the heart flutters and can increase your risk of blood clots, which can go to the brain, causing a stroke. Diabetes, depression, and emotional stress are risk factors that tend to be stronger or more common in women than men as well. So we have to keep those things in mind. And people may also be surprised that certain people are more disproportionately affected by stroke than others. African Americans have twice the risk of first ever stroke than white Americans, and that's largely due to the rates of high blood pressure. We believe African Americans have the highest rates of high blood pressure in the world, and African Americans are more impacted by stroke than other racial ethnic groups within the American population. So just some things that we definitely have to pay attention to, especially when it comes to women.
And our guest today on Weekend Connection is Dr. Rani Whitfield, a board-certified family physician. He's a motivational speaker and has traveled all across the country, speaking at megachurches, universities, high schools, middle schools, and elementary schools, delivering his messages of what he believes is our most important possession, our health. Now, they just wrapped up the American Stroke Association's International Stroke Conference, I understand. And out of this, research was presented stating that church-based health intervention reduced stroke risk behaviors. And this is part of the SHARE project. Could you discuss a little bit about this project?
Yeah, the Stroke Health and Risk Education Project, or SHARE, it's a faith-based, culturally sensitive behavioral intervention study. And it's designed to help reduce stroke risk factors behaviors such as physical inactivity, poor eating habits, and uncontrolled high blood pressure. The one-year intervention included a physical activity guide with pedometer so you could trace how many steps you're moving. It had educational materials on healthy eating, information on blood pressure management, and it also included motivational counseling calls and support workshops with peers. So it's a really cool program. Those in the intervention group had an increase of 0.25 cups a day in fruit and vegetable intake, which is something that we're really promoting, more fruit and vegetables. Fresh is always best. The intervention group participants decreased salt intake by 123 milligrams per day compared to the control group, and we know that salt is something that can cause elevations in blood pressure. And there was no difference between the groups in physical activity level improvement. So SHARE study has got some work to do, and more research is needed. But the success in improving stroke risk behavior suggests that faith-based programs may be useful to reduce stroke in communities, including Hispanic Americans, which is the nation's largest minority population. So a really powerful study that's going to lead us on to other studies.
Dr. Rani Whitfield is our guest today on Weekend Connection. He's a board-certified family physician, and we're talking about this most important matter of suffering a stroke. Dr. Whitfield, how would one recognize and treat a TIA, or what is known as a warning stroke?
Also known as a mini stroke, especially in the church communities. I hear that quite often. But a TIA, by definition, is a transient ischemic attack, and again, often called a mini stroke or warning stroke. And the difference between a TIA and a full-blown stroke is that the blockage is temporary or transient. A stroke is basically when one part of the brain dies. So if you have temporary decreased blood flow to the area, you can have symptoms like that part of the brain has died and the area won't function, but it reverses itself. So the symptoms are exactly the same as a stroke, but they usually last less than 5 minutes. Regardless if it's a TIA, you think it's a TIA, you think it's a stroke, you think it's Bell's palsy, if you're having those symptoms, you should immediately call 911 at the very first sign of any of these TIAs or strokes, because that time lost is crucial. We've got to get you to the hospital urgently.
Now, earlier we were talking about the stroke risk factors that cannot be changed, perhaps are hereditary. What are some of the factors that can be changed or treated or controlled?
Well, we've got to change lifestyles and behaviors. And, it's crazy. At the beginning of the year, a lot of my patients come in with lists of New Year resolutions about being healthy and losing weight. And so we've got to modify the behaviors that increase our risk of heart disease and stroke. So we want a healthy brain as well as a healthy heart. So we've got to manage our blood pressure, control our cholesterol, reduce our blood sugar, get active, eat healthy, and maintain a healthy weight, but also stop smoking. The American Heart Association has a campaign or a concept called Life's Simple 7. So we're going to modify some behaviors and add some positive activities. And again, those things are managing blood pressure, controlling cholesterol, reducing blood sugar, getting active. If we can do Life Simple 7, we can reduce our risk of having a heart attack or stroke.
Dr. Rani Whitfield is our guest today on Weekend Connection. Do you recommend that older people get health screenings each year for their arteries?
It's undebated that everyone should have regular blood pressure checks, and I know there's certain recommendations, but if you come into my office, your blood pressure is checked at each visit. It's a simple vital sign that can be done, quite easily. But what we need to do, I think, more importantly, is have conversations with our doctor to determine whether a test may be needed for that individual, because it can differ from family to family.
Now, you were referring to the importance of eating more fruits and vegetables. Is there any research that would show that eating more fruits and vegetables may reduce the risk of stroke?
The American Stroke Association likes to say what's good for your heart is good for your brain. And a heart-healthy diet is related to decreased blood pressure, which is our number one goal when it comes to stroke prevention. In a recent study, participants who followed the dietary guidelines lowered their blood pressure measurements than those who did not. And we know that a diet low in sodium and high in fruits and vegetables and whole grains does not only a body good, but does a brain good. So there has been some recent research that supported that.
Everybody's heard about the Bible Belt, but I have heard about the so-called stroke belt. Dr. Whitfield, is there anything to this?
Oh, most definitely. Those southern states from Arkansas, Texas, Louisiana, Mississippi, Alabama. Now we can call it the hypertension belt or the heart disease belt, definitely the stroke belt, because stroke deaths seems to be higher in the southeastern parts of the United States. Again, North Carolina, South Carolina, Georgia, Tennessee, Mississippi, Alabama, Louisiana, and Arkansas. These states have higher rates of stroke and heart disease. And we're not quite sure why that is, but definitely there's validity to that name, the stroke belt.
Our guest today is Dr. Rani Whitfield, a board-certified family physician, currently in private practice in his native Baton Rouge, Louisiana. Now we're told that we can spot a stroke fast, and we know time is of the essence. Could you walk us through the FAST points?
Oh, definitely. Time loss is a brain loss when it comes to stroke. And through our Together to End Stroke campaign, the American Stroke Association teaches us that acronym FAST, F-A-S-T, which is a very easy way to recognize the most common stroke warning signs. Not all of them, but the most common. So FAST stands for, the F stands for face drooping. Does one side of the face droop or is it numb? The A stands for arm weakness. Is one arm weak or numb? The S stands for speech difficulty. Is the speech slurred? Is that person unable to speak or talk? Or are they hard to understand if you're listening to them? And the T stands for time to call 911. We want to reduce our risk of heart disease and stroke. We want to prevent it from happening. But if you recognize the warning signs, it is time to call 911. And again, time loss is a brain loss. We've got to get the person to the hospital within a certain window. If it's a non-hemorrhagic stroke or what we talked about earlier, ischemic stroke, there are clot-busting medications that can be administered that actually may reverse that stroke from happening. So time loss is a brain loss. And trust me, I've had patients that have gone to take a nap, had signs of a stroke and laid down and took an aspirin and said, I'll wait till later, but we can't do that. If we recognize these warning signs, we've got to call 911. So that acronym FAST, F-A-S-T, we've got to remember.
Our topic today on Weekend Connection is stroke prevention, and our guest is Dr. Rani Whitfield, a board-certified family physician. Doctor, exercise, 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 and more exercise. It seems like health clubs are all over the place, but I've actually read in various reports that exercise is overrated. But where do you stand on this?
I don't think there's any doubt that activity is an important component to being in perfect health. But you don't have to be a marathon runner to be that way. And there was a recent study that says women can cut their stroke risk by 20% with moderate exercise like brisk walking a few times a week. So do you have to be a marathon runner? No, you do not have to be. Another study also shows that better fitness in midlife may support brain health. So not only preventing stroke, but also preventing us from cognitive decline. So, we talk about the relationship between the brain and the heart. If you're taking care of the heart, you're also taking care of the brain as well. Being physically active is an important part of preventing heart disease and stroke. And so to improve overall cardiovascular health, the American Heart Association suggests that we exercise at least 150 minutes per week, 75 minutes per week of vigorous exercise for adults. And so that doesn't mean running marathons, but that could mean gardening, dancing, having fun with the family. We want to do this at least 30 minutes a day, 5 times a week in an easy method, something that you're going to do, something that you're encouraged to do. And again, people that benefit from exercise are those that go from doing something to nothing. So we need to get started on doing those things today and not waiting before it's too late.
And our guest today on Weekend Connection has been Dr. Rani Whitfield, a board-certified family physician, currently in private practice in his native Baton Rouge, Louisiana. Dr. Whitfield, how can people learn more information about having a healthy heart? Is there a website you can direct us to?
Definitely. The American Stroke Association's website is stroke.org. And you can also call 800-4-STROKE. And I'll tell you, this is some really great information, some great resources on the websites. So I encourage everyone to go check it out, especially if they didn't catch something I said or there's something that they need to research for themselves, whether it be risk factors, diet, exercise. It's all on there.
Dr. Whitfield, again, thank you for joining us today on Weekend Connection.
Thank you so much.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.